approval process. But that obviously, as one of the other companies mentioned, into cancer drugs or cardiac arrest, for example, that would put us in class 3. And that's going to cost tens of hundreds of millions of dollars. So our strategy right now is go down the consumer route, do the clinical validation in Hong Kong. It's an investigator-initiated study, so our advisor initiated the study. So once we get that validation, we also have a similar strategy. We can either get acquired before that, or that's our sort of strategy right now.
How much do you foresee insurance costing for this product?
So that's a good question. So we actually have another company in the US. I won't name which company it is, but they're trying to replace a panic button, even though their end goal is the same as us, which is cardiac arrest detection, at least if you're talking about the cardiac arrest side. So yeah, I mean, Sorry, I don't know if I answered your question.
Well, no, do you have an idea of how much it can cost you? Like, or
in terms of insurance?
Yeah, like, or are you just saying to yourself, there's an issue, but you don't have
in terms of the insurance, I mean, there are different sort of distribution channels and models that we've thought about. We haven't really considered the actual cost of insurance. So the reason why I brought up the panic button was the way we deliver might be to replace the panic button. Like in Hong Kong, we have something called Pinonjol. It's very easy for us to have LTE connection here and GPS that we can add on. We can actually replace that through data collection and have a business model that way. In the US, for example, if you go down the panic button route, you're not regulated by FDA. So there are different ways that we're considering.
Like soon as we're at the end, like soon as somebody having a heart attack and family suing.
So I guess for the consumer products, we're not actually advertising. We can do cardiac arrest detection. That's a separate study that I wanted to sort of raise because I think that's quite meaningful. For example, the US has over 424,000 out of hospital cardiac arrests every year. So that's separate. The reason why I brought it up is we're also working on that. But the main strategy for us in the next year or so is to commercialize this product as a portable blood pressure monitor that people can take the blood pressure on the go anywhere, anytime. That's the sort of our strategy right now.
Any more questions from the investors? No? Thank you.
Thank you so much. Thank you very much.
Thank you very much. So now I would like to invite the representative from Ananflow.
Good evening. I'm very honored to be here. My name is Wen Huang, and I'm founder of Ananflow Technology. So nowadays, I believe most of you are using your mobile tablet and smart TV for your entertainment. And behind those devices, there's the OTT streaming platform. And what we do is the next generation OTT streaming platform. Our pay TV and award-winning technology utilize the Internet of Things to do fog and cloud streaming so that you can really quickly roll out the platform at very low cost. And this is especially useful for the emerging market, such as Southeast Asia, because they need to really rapidly roll out the service, but they don't have much budget. And also they don't have a legacy system to get rid of. So Southeast Asia, you know too, is a very booming market with a large population and many potentials. So, but a company like Netflix just failed there because they don't have the local content, they don't have the license, they don't have the local understanding. And what we have is we already have a partner that has got the license and also the local content providers that understand the market very well. So what we together we are going to roll out this Southeast Asia OTT streaming platform, targeting the young generation. We will have the live concert, the live channel, OTT, VOD content, VR education, etc. So the companies such as Netflix, Hulu, TVB, they can utilize our one-stop solution to reach out the whole region all at once. And also the advertisement company can do that too. So our technology are actually from UST Hong Kong. It's a homegrown technology. We are already serving China Mobile Hong Kong, Hong Kong Jockey Club. So one of our founder, the inventor, is the inventor of the technology. So we will keep our innovation going, and also and our other founder actually have many years of experience in the field of entertainment as well. So we believe we can provide this new platform for the entire Southeast Asia to benefit all the content providers and advertisers.
Thank you. Any question from the investors? Thank you, Mr. Tadio.
So who's paying you? Who's your ultimate customer?
The customers will be, for example, right now, like the China Mobile Hong Kong, because they have content they need to stream, so they will be our customers. The Hong Kong Jockey Club, they have a race, they need to broadcast throughout the year. And in Southeast Asia, what we are going to do is actually we build up this platform so that the young user, they can come up, and we might use the advertisement for that, generate their customers. And also if, for example, say Netflix, they want to utilize our platform, they can pay us as well.
Thank you.
So does your platform compress the data in a way that makes it easier to stream and utilize this?
We actually focusing on the delivery method. So we are more on the algorithm to how to deliver the content throughout the network using different nodes more smartly, so that it uses less bandwidth and also lower delay. So, but we can work with any compression like H.265 or any one because we are transparent. I'm sorry? Well, we first of all we move very fast and we target to this new market, so we already have the partners and stuff. So we want to just quickly roll out the service. So that's one thing, and also we, as I mentioned, we have many patented technology from UST Hong Kong, and the inventor is our founder. So he will keep innovating, and we will keep build our product to be more advanced.
Thank you. Any more questions?
Yes, why are you limiting your market to Asia only?
We're not limiting, but we want to start it there. We already started in Hong Kong and some part of mainland China, but we found out that Southeast Asia has a lot more potential, and also we also have some partner there. So we think, and also I think right now most of the investment and is going there. So it's like a lot more growing potential. But after that, we will grow elsewhere too. Yeah.
So just to follow up, how much have you raised to date? How much money have you raised?
We at the moment we only have some angel fund, like $2 million Hong Kong dollars.
Okay, and you said you have customers, existing customers?
Yes.
Can you tell us a little bit more about that relationship?
We have China Mobile Hong Kong, and so they use the complete solution. So from the source to the end. So we will help them to stream their channels and catch up VODs.
I guess my question is, do you beta testing with them?
No. We already deployed it since 2012, the end of 2012. Yeah.
What are your revenues? Just rough. What's your revenues roughly?
Well, because the first couple customers, they are how to say, we have better discount for them. So it's we're still not like breaking or anything.
Maybe instead of asking what your current revenues are, what's your revenue model? How many you make money? Is it per minute, per view, how are you gonna make money?
We like concurrent user. Sometimes like the concurrent user predict concurrent user or the daily usage, the peak usage. We can use that to do the calculation. And also we can do per channel, like okay, how many live channel, then we can charge that too.
Thank you.
Last question.
Streaming is all about high pitch rate applications. Do you see any competitors in Hong Kong or Singapore?
There are some competitors such as like Oculus but what we
What makes you different?
because we have some patent technology to actually make the high bit rate stream to be smaller bit rates and then goes to different path, and then we can have redundant to make sure that after we receive just part of the stream, we can construct the high bit rate again. And also the way we route it, we optimize the path and optimize and distribute them in a more optimal way, so that the loading level is reduced and also the total end-to-end delay is reduced.
Thank you, Ananflow. Thank you very much. Okay, so here comes the last pitch from MedEXO Robotics.
Good evening, everyone. We are MedEXO Robotics. We built a multifunctional exoskeleton for Parkinson's diseases patients, and our team members are mainly come from Oxford University and Imperial College London. And our product, we see that the Parkinson's disease patients are suffering from a serious tremors that they cannot even handle their daily life. They cannot feed themselves, they cannot drink themselves. And our product has three characteristics that can help them solve the problem. The first one is we are affordable for most of the people. We have the research show that the average annual payments for those patients are about $2,500 US dollars, and for our exoskeleton, we are costing them about $300. We have two versions. The main version is about $300 US dollars, and the preliminary version is about $700. And the second characteristic is about we are multifunctional. Unlike other products that they can only for train the suit, our product is multifunctional. We can make them handle different situations. The patients with our exoskeleton can read newspaper themselves, and also they can even take a ball to play with their grandsons and so. And the last characteristic is it is very light. And we work with a partner of Parkinson's Disease Association of Hong Kong. We know patients very well, and we understand that minimize our weight of the exoskeleton to about 1 pound. And in this till now we want 500,000 funding to raise, and because we want further prototyping as well as to apply more patient IP protection. Also, we will launch our product in Indiegogo in the early of 2017.
Thank you. So questions from our judges? Mr. Talio.
What's your role in the company?
I'm a business developer.
You're in business development. And the CEO is based where?
He is now studying in Oxford University PhD to do further research on this project.
Okay. And how far is this product to market? Like when will it be actually commercialized?
Actually, the product is now in the finalized stage, and actually, I can show you some video about the latest product.
I'm not sure all the judges did see it, so it's moving up there. But okay, so it's ready, it's available in the market. It probably costs millions of dollars to develop, or not?
The price of the product will be about two versions is $300.
Yes, but how much does it cost to develop to date? How much has been invested in this company so far?
We raised about 500,000 Hong Kong dollars till now.
Not very much.
So we want further $500,000 to further our prototyping.
I would have thought it would take millions of dollars to build a product.
So you mentioned wanting to protect the product in terms of the IP in the product. Have you already applied, or have the company applied for any patent around the technology for the product?
we have not yet applied for any IP yet, but we will, after the finalized stage, we will apply for the IP.
What are the government subsidies or grants? Do government support there in the financing?
We have no any government subsidies. We are a social enterprise. Why we would separate for two versions of the products is because the beta version is about $300. We want to subsidize the preliminary products about $700. In extra profit, we will subsidize for those low-income families to use the exoskeleton.
So, how old are you?
I'm 20.
Congratulations on doing such great work as a GMA. Is this a retinal solution? In other words, can someone use their eyes to move their hands, or is this something that is pre-programmed per motion? In other words, how does it work?
For the Parkinson's disease patients, their hands are always suffering from the tremors. They would just like, if I want to hold this mic, my hands would go like this. I can't hold the mic exactly. And after using the exoskeleton, it can reduce about 70% of the tremors. So also we can have an app that can monitor the rate of it, so they can handle the mic exactly.
Any more questions?
Yes, in this stage we are focusing on the Parkinson's disease patients, and we are other potential fields to apply this technology about the VR technology also in sports training field also.
I think you need to hear
Yeah, I just want to know a bit more about your team. You mentioned about Oxford and Imperial College, and all the prototyping, invention, research, and so forth, as all in England based. Is there any collaboration between England and Hong Kong or Hong Kong Science Park, for instance?
Yes, we are now located in Hong Kong Science Park, and also although most of our engineers are now studying in England, but we are based both in London and Hong Kong.
Not that I mind. I'm just wondering if you do the actual winner later on, what will you be using the money for straight away for what? Prototyping or research or a combination?
The first one is eye protection. The other is to fine-tune the final MVP. And the third one is we will go into the final stage of mass production. And the first market we will distribute is Hong Kong, because we have a very close relationship with the Heartisans Disease Association.
So you're an NGO company based in Hong Kong, registered in Hong Kong?
We are not NGO, we are social enterprise.
Social enterprise. In Hong Kong, England?
In Hong Kong.
In Hong Kong. Great, thank you.
Thank you. Thank you very much. Thank you. And well, for the meantime, I would like to invite all of you to please give a big round of applause to our judges, because it's not easy to listen to all these 10 wonderful ideas, especially during dinner time, okay? So you have even tough work to do, because our competition is fair and, well, very, very professional. So please, may I invite all our judges to please follow our colleague who raised up his hand over there, wearing a gray suit. Enter the judges room, please, for further discussion. Thank you so much. Thank you. 其實佢哋好值得我哋俾多啲嘅掌聲俾佢哋，因為係真係唔容易啊！聽10個咁好嘅 idea， 喺呢個時間血糖特別低嘅時間，所以係好辛苦嘅，唔容易。咁而家咧，佢哋需要咧就係入去我哋嘅評判室嗰度，就係決定究竟邊位會成為我哋今晚嘅 winner。Okay, so while waiting for the final result, I would like to invite Mr. Albert Wong, to please present the certificates of participation to our 10 finalists.